wanted to go over breaking down some of the big lifts and, more importantly, talk about how to perform the fundamental lift such as the squat. So what you're seeing here is a little document that I created for my clients, and I just want to dive in also into these. So I want you to, before you even think about this, is take 3 deep breaths. I want you to close your eyes and really focus here. The first breath I want you to take is to breathe into your belly, bringing air in from your nose and exhaling through your mouth. Next, I want you to be breathing into your sides, breathing in through your nose and pushing into where your hands are, exhaling. And then lastly, think about your back, breathing into your back, so breathing in back here and exhaling. So what we just did were a couple things. Imagery, number 1, focus, intent, and a sequence of multitude purposes for the aspect of breathing. We just breathe in every aspect in a 360 component, which is required for creating stability for any and every lift, and not even that, but any and every movement that we do. Something such as picking up this water that's extended far away from me requires me to have stabilization for reaching for that. So the big lifts are primarily your back squat, which is what I'll be covering today, deadlift, bench press, overhead press, and pull-up. Those are the 5 fundamental movements that every single workout is generated off of, and they are functional because we do them all the time in everything we do from a day-to-day basis. So covering the squat, we can go into depth here of the high bar squat, low bar squat, front squat, and in general, just the back squat. And the back squat compromises these 2 aspects right here. So in order to do a back squat, obviously the bar is going to be placed on your back, and the spine needs to be in one solid unit for any of these motions. Especially as you are descending down into your squat and coming back up, spine needs to be remained in neutral, and neutral is what I'm going to call your pelvis position. So this is anterior rotated, this is posterior rotated, and neutral is in between, where I'm able to keep my ribs down. My pelvis is in a neutral position, not dumped this way and not dumped this way. So the spine should not move, in theory, in any part from your neck to your low back through any duration of the squat. It should only change orientation, an orientation such as from being positioned vertical to slightly horizontal. Movement should only occur at your hip, knee, ankle, and feet, and then I'll also tie in here your sacrum. And your sacrum is the very, very bottom part of your spine right here that actually has to round as we go into the bottom of a squat. If you lack mobility in your ankle, your squat will suffer. If you lack mobility in your hip, your squat will suffer as well and lead to more compensation strategies. So if you lack mobility, and just a little tip here, if you lack mobility in your ankle, it would help to benefit to put a plate underneath your heels for creating more of that depth. So to accomplish a squat, an athlete needs to build co-contraction of your trunk muscles and your intra-abdominal pressure. Co-contraction is used by contraction of your diaphragm, which is closely related to your pelvic floor, as well as your abdominal wall. Intra-abdominal pressure is used under high threshold loads, such as going for a squat or picking up stuff to help your friends move. We really require intra-abdominal pressure for those higher intensity loads. So I'm going to show you some images here to make all this make sense, but everything is connected. So actually, I'll go ahead and show you now. So this is what we require for stabilization. When I say pelvis in neutral, that is what this is. Everything is boxed up here. Pressure is directly going down and directly coming up, and this is pelvic floor, and this is your diaphragm. So as you can see, when these 2 positions are leveled, with your ribs leveled with your pelvis, this creates an ideal situation for intra-abdominal pressure to maintain your stability. Now, on the other hand, if you are like me actually, and you're anteriorly rotated at your hips, which means your hips dump forward, creating that offset balance between your ribs and your pelvis, we are unmatched, so pressure is being distorted in each direction. So it could go anywhere out here and cause hernias, which some people have acquired when lifting under heavy loads, or it could, just somehow travel down this way and, you have a leaky bladder during certain activities, or it could just shoot this way and we have disc injuries as well. So the pressure kind of can just go anywhere in this range because it's not directly forced down. I really do love this, and also it does help understand some things. So if you do understand the position of your ribs, so if I'm demonstrating this right here, I am arched here at my low back. Sorry, move my jacket away. Arched in my low back, and my ribs are also pointed upwards, right? So this is up, and my hips are, I guess they're down this way. So my hips are down here, ribs up. So pressure could just go anywhere in this area. Now, when I focus on pulling my ribs down first, there's ribs down, and then I focus on posterior tilt. They are now centered and even, and this is what we will call a neutral for proper stabilization. And this, again, is the side view as well. So going down in here a little bit further, this is showing the lever arms associated with your squat related to your hip and your knee. So here is the hip lever, knee lever, and again at the bottom of a squat, here it is. And this is a good, I've taken a lot of these from articles, and I love this photo too, is to show this is the, I'll get out my little pointer again. This is the force of gravity. Oh, where'd it go? This is the force of gravity that you will go under with even doing a bar squat. On top of gravity, we also have this force here, which is the actual weight of it too. So this is a lever arm, which is our trunk, and this is a moment arm, which is our femur, to create some of that movement. So it's called, never mind. So the direction of force too is also being compounded down here at your chest. So in order to counteract these forces, we need to have good stability here by creating it from these two levers. And this just is a good example of proper depth. So this is just two parallel, and while maintaining a horizontal, I guess a proper angle for your torso in order to maintain the stability. Now, I would question and ask this person, were they using their core stability for this? They feel their abs engaged, and just kind of see the more action of this. But as a bottom picture, baseline here looks great. And I'll go into all that a little bit later. So just wanted to show you those up here. Talking about that intra-abdominal pressure as well. And I took some screenshots too that I could show you of the, yes, here it is. So this is also demonstrating some of where that pressure is and what is needed to maintain proper stabilization. So again, here's where the pressure is being pulled down by diaphragm, and this is just the act of breathing into your sides as well. So really like that graphic, and this is a good one as well, demonstrating intra-abdominal pressure and where we're breathing into. So here's the spine, and when we create intra-abdominal pressure, such as this, we're really using it in all aspects here: posterior, sides, and anterior. And again, here as well, just shows what happens when we do intra-abdominal pressure. It really stabilizes the spine by pulling everything closer together. So, the most vertical your torso is going to be the easiest to maintain the position of your trunk, which means best stability. So when I showed you this angle here, the more, where'd it go? The more vertical it is, the easier to maintain. So here is somewhat not vertical, right? We're kind of more in that mid-range. So this is why I would question, again, dive in a little bit deeper of what kind of stability does he have here. Now, this doesn't say this is wrong because he is in somewhat of that horizontal, but he is going to be requiring a lot more glute force here to maintain that. So it's not that it isn't a bad thing, and it's not that it isn't impossible. It's just you have to be able to stabilize your spine in that position. Hip flexion and your pelvis position is important here, which is what I talked about with having the mobility at your hip and also keeping that pelvis, that spine in neutral in relation to dumping forward with your hips or your ribs being opened up here. So, and a butt wink is when you go into the bottom of the squat, and that last little bit of your squat when you're descending down, your low back kind of dumps a little bit. So you kind of, it looks like a butt wink. And if I could look it up here, I'll show you a video of that. Gotta kind of be careful on what you see here. Type into YouTube butt wink. I want to see if he actually, yep, here he shows it. Let's see if he actually goes into it. Right there. So that is a butt wink. And I'll attach this video here too as well, so you can kind of dive in more into what the butt wink is. But I do want to make it clear it is at the lumbar spine, when the last few vertebrae round, rather than the sacrum. So your sacrum actually has to rotate a little bit of counter rotation in order to achieve a depth in squat. Now, if you can't handle a good depth in squat with proper stabilization, then compensation strategies come in, and you will start to use your back rather than your glutes in order to come up out of that position. Also, the bar placement. So in ranking of easiest to maintain for proper stability and making sure like the easiest to stabilize rather than the hardest, and a good progression of how you should go into your squats is starting out with a pole squat. So what that is both arms holding onto a pole somewhere, and you're just going down into a bodyweight squat, but you're also holding on to something. So you're able to really focus on keeping some of that pelvis in neutral, ribs pulled down, and all the other aspects I'm going to talk about later. You're able to work on that, practice it, and maintain it without any extra added weight to you. Added weight to you is going to have you, like I mentioned earlier, increased load is going to be an increased demand. So essentially these are all starting out body weight, and then we move into placement of where we're putting the weight. So the next would be just a regular body weight squat, getting rid of that pole, and now you're doing it without holding on and having that extra stability to help you. Then would be a front squat. So holding your weight at your chest here. Goblet squats are awesome for this. It's a progression from the bodyweight squat, because you can still have really good core stabilization without having to work too hard. And it's the easiest to maintain. Rather than we begin to place our bar on our back, it's going to require more stabilization. And also it could activate your posterior chain to then go into compensation strategies. If we are using our posterior chain too much in our squat, it's going to look like this, right? Because now we're activating these muscles and arching our low back, which takes away our stability here at our core. So I know there's a lot of emphasis on building up your posterior chain and always working your posterior chain, but you have to make sure you're doing it effectively and still having good control and tension with using your posterior chain at appropriate times, but also not letting it lead to compensation strategies where you're arching your back and all those things. So high bar placement, that would be up higher for your back squat, and low bar placement would be a little bit lower. The low bar placement actually makes more of a horizontal torso. The athletes are going to have a harder time and more difficulty stabilizing and require more force from your posterior chain, which could potentially lead to compensation strategies, which I talked about, because you do have to require more. You could be pulling it from your low back rather than your glutes. So these are images that I already showed you. This is comparison of that torso angle for the bar placement and front squat. So remember we talked about the more vertical that your torso is, the easier it is to maintain. So here's the front squat, or a little bit more vertical. Back squat positioning. I can't tell the difference between which one this is, but I'm going to assume this one's low bar and this one's high bar, because it did say low bar was the more horizontal angle. And I do want you to pay attention to shin angle. This one's very vertical, and this one is more horizontal. And again, here is a shin angle I'm showing you. This one is a more horizontal. This torso is more vertical. This shin is more vertical. This position of the torso is more horizontal. So inverse relationship. So the technique of how to do it. You want an elongated spine. And there is an inverse, and here's to the shin angle, is that there's an inverse relationship between the angle of your shin and the angle of the torso. So, meaning if the shin is more horizontal, your spine is going to be more vertical, and vice versa. More horizontal or more vertical your shin, or horizontal your torso. And we want ideally this. The more vertical your torso is, the better, the easier it is for you to stabilize. Going into this is going to require more stabilization, which could put you at more risk. But this isn't to say don't do it. It just requires a lot of work and practice and technique of maintaining stability in that position. Your ribs need to be pulled down, so capping off that neutral pelvis of here's our pelvic floor, here's our diaphragm. When we pull our ribs down, it is creating that neutral pelvis so we can stabilize our spine. And we are using the internal and external oblique to obtain this. And the goal is to pull your ribs down this way without rounding your back forward. So it's really using the abdominal walls, internal and external oblique, to round while my spine stays in one position. So again, I'll show you this here from an arched position. Here's ribs open, and now I'm going to pull my ribs down using my abs rather than leaning forward to make it happen. So showing the difference again, this is using my abs and my hamstrings to pull pelvis and my ribs down, rather than, if I were to do this incorrectly, it would be like this. When an athlete attempts to pull their ribs down and flexing their spine, they're not doing it correctly. They're not actually using their abs to engage that. So they will flex their spine instead of downward rotating the ribs onto the spine. Maintaining that neutral pelvis position, not just in step up, but not just in set up. That's what it's supposed to mean. And this is important too. So I talk a lot about neutral pelvis, and this isn't just setting up your squat, but this is during the whole entire movement. To really maintain that and not lose it. That's when that butt wink happens. That's when we lose stability, is when you neglect this and you stop focusing on this through the entire movement. So the goal is to maintain your pelvic position and core contraction through the whole movement with an intra-abdominal pressure. So we pull down the ribs, we have our pelvis in neutral, again through the whole movement, not just for the setup, but also activating our abdominal wall so that is pushing out into our sides. And this is what we first talked about when I started this, was breathing into your belly, breathing into sides and low back, because it needs to be a 360 effort, which is where a weightlifting belt comes into play, is because it actually provides contact, or it provides tactile cues with the belt being around you to really feel it completely 360. So when you are bracing, you're breathing into all aspects of that belt. So the goal is to breathe into the belt rather than suck your air in. And your knees can go, they can go 1 to 2 inches past your toes. So if you hear somebody say knees can't travel past toes, I would have you tell them, oh, okay, so how do you go down steps? When you go down steps, do your knees pass your toes? Yes. What about going up steps? Do they go past your toes sometimes? Yes. What about stepping off the curb? Yes. These are functional tasks that we do every day, and the knees can travel past, or the toe, knees can travel past toes. About 1 to 2 inches is still safe and effective without causing any additional knee pain or knee stress. But so as long as the foot stance is maintained, which means full total contact with our foot on the ground. When you're doing this and knees go 1 to 2 inches past your toes, but your heel is lifted, not effective for you. The next would be using cues. So I know you have all heard the cue of keep your chest up through the whole squat. Not necessarily true. That is going to cause you to take away what we just worked on with pulling our ribs down. If you focus on keeping your chest up, what's going to happen is we're going to arch back here again, and then we're going to go down to a squat with our chest up. The goal should be keep your spine in neutral. So a good thing would be to say is to keep ribs pulled down, Your chest is still up because it's not collapsing here, right? But it is not over-exaggerating it to this point where now we have taken out our stability that we had and arched everything. So one good way to do this to see if you can maintain a good position of stability while keeping your ribs pulled down and chest in a good position is practicing forward-facing squats. So an example of what that looks like is this right here. You're forward-facing, your knees are traveling past toes about 1 to 2 inches, and I would actually question this arch right here. I don't really care for that, but this is how you can practice it to make sure your knees are traveling and you're still maintaining that stability. And here's just another image of what that roundedness looks like when you don't have your ribs pulled down and your hips are rotated too much anteriorly. Where's the pressure going to go? So next thing I want to point out that I already talked about is keeping that foot fully loaded and flat. So think of your foot as a triangle. You have your big toe, you have your pinky, and you have your heel. You are creating a triangle at that point, and you want to make sure you're always in contact with that point with equal force distributed between those angles. Really, really focus on keeping that big toe down. And practice doing this in half kneeling or in a squat, where you're squatting down and you're you're kind of moving your body weight over into that big toe and back, rocking back and forth to make sure you can keep that big toe down while you're shifting your weight over and back from your foot. It's really good to practice this in a half kneeling position where you can literally sit and stare at your big toe and ensure that when you move your knee over your foot as if you're going into a squat, that you can keep all points down and you can keep your big toe down. You will often see people when they're trying to really overcome a lot of weight, they're coming up out of a deadlift, they're going to rock back on their heels and lift their big toe because they're trying to pull in whatever way they can to accomplish that task. Your body's smart, I've said this before, but your body follows a path of least resistance. It's going to do whatever it takes to get the job done, and that is sometimes compensation strategies. So keep that full foot loaded, and next point would be to keep it screwed into the ground. When you actually practice, and I would say do this before you go into a squat, so when you're setting it up, before you even get that bar on your back and say you're at that point where you can do a back squat, I want you to find your good position for your feet. That is a whole other thing I could talk about, is what position is right for you in your squat. But it is keeping that foot flat and then kind of pressing down and pushing out without moving your feet. So it's almost like you're forcing out into the sides of your foot. If you do that even in standing right now, if I sit here and I focus on pushing down into my feet and then pushing out into the lateral aspects of my foot, I feel these muscles start to engage. When those muscles engage, they are your hip stability muscles. You have created stability at the hip. So really, really cool that just that simple little thing of thinking of screwing your feet into the ground and directing your force down and out really creates stability at the hip. And we know in order to create movement, we have to have stability at the hip. Also having stability at the hip, we have to have it in that whole part of our trunk, right? So our trunk is here at our hips and it's also here at our chest. How do we keep that stabilization besides doing the things that I talked about? Ribs pulling down, all of that good stuff. Breathing into 360 is also at your lats. So if you think of doing a pull-up, when you're doing a pull-up, your shoulder blades are my hands, right? And then right here on my nose, right here in the center of my body is going to be your spine. So when you're doing a pull-up, you start from this position, you're grabbing the bar, right? Your arms are overhead, you're pulling it down. And as you pull it down, your shoulder blades go from here to here. They're pulled down tight to your spine. If something is pulled close to your spine, do you think it is more or less stabilization? It would be more stabilization because it's closer to the spine, it's more locked in. So a good cue that I'd like to say to clients and athletes is lock your lats down. So that is literally pulling your lats down so that your spine is stabilized, and it's not, you want to make sure that when you do it, you don't arch your back in order to get your shoulder blades together. You're doing it as like you're pulling down this way. So if I were to do like a tricep dip and I have my arms stuck to my side, that's mostly what I mean by lats locked down. If you're doing a front squat, it's going to be a lot more harder to do and not as much necessary because you don't need as much stabilization because you are counteracting this weight and you have your body in a more, or your torso is in a more vertical position, easier to maintain. Bracing. So this is holding your breath. So some people, if they are really good at this, they can hold their breath through the whole movement and then inhale, exhale before they go back down into a rep. But ideally you want to inhale as you are moving away from your body or a center. Exhale as you're returning back to center, or what I like to say is exhale as you are exerting energy. So for a squat in particular, I will hold my breath, so it's as if somebody is going to punch my stomach. That is what bracing is. So if somebody is to get ready to punch my stomach, I'm going to tighten up, hold my breath. That right there is a prime example of core contraction. That's stabilization. That's intra-abdominal pressure. So you want to feel that as you are going through your lift. So I will do that before I go down into a lift, and I'll go down through the whole rep until I feel like I'm getting ready to lose my breath and I need to redo it. So then that's at the top of my lift. When I get back up, I'm going to reset with it and do it again. You can do it that way as well, or you can inhale as you are going down into your squat and exhale as you are coming back up. The point of that is so that we keep this keep it rounded and breathing into this area to create stability as I'm going down, and at the bottom, going to exhale. So the bar path should realistically and most of the time follow a vertical path for the most part. Even when you're going down and coming back, it should be more vertical rather than horizontal. So if you're going horizontal and you're doing this, you probably have too much horizontal torso orientation rather than vertical. So try to keep the bar path following a vertical path. And last but not least, not a lot of people talk about this, but it is very much related. Your eyes, the direction and the position where your eyes are is where your body is going to follow. So have your eyes follow the direction of the movement. A big thing I see a lot of people do when they're coming up out of a squat is they're going to look up. It's almost like they're at the bottom of their squat and they're looking up to like get help. What happens when you look up is your head goes up. And when your head goes up, you kink here at your neck, creating more of an arch. And as I mentioned that your body is all connected, when your neck arches, your low back's going to do the same thing. Your neck and your low back are oriented the same. They both have that curvature that are identical. So if your neck's arching, your low back is going to arch and can also predispose you going into a compensation strategy. So what I like to have clients do and what I tell them to do is when they're squatting, keep your eyes forward. You have a mirror in front of you for a reason, and that's why I really do love mirrors, is you can watch your form and you can also, keep your eyes focused where you want the body to go. So, for instance, if I'm going into a squat, I want to stay, before I go down, I want to stay looking forward. And I'm going to stay looking forward until I get to the point at the bottom of my squat. I'm going to get my eyes to go a little bit downward, like I'm going to look a little bit downwards so that I can keep my stability here rather than arching my neck and looking upwards to come up out of it. So even when I come up, I'm going to keep my eyes focused in front of me the whole time. For an RDL or something along those lines, I'll start out with where my spine is facing. I'm going to start out looking forward, and then I'll slowly move my eyes down as my body is going down, and I will come up with my eyes and my body as one unit. So I would practice just for intro into this to see if you can maintain stability and good technique as you're doing this, and really practice some breathing strategies. Practice while facing squats. And I'm actually going to add in here, I took this clip too, is to practice breathing into your low back, which is what I'm trying to do a lot more because I am anteriorly rotated at my pelvis. I'm really working on feeling more air here to loosen it up. Because I'm rotated anteriorly at my pelvis, this is a little bit more junked up. There's a lot more compression here. So if I can get down into this position and practice breathing, I'm one, lengthening this area and able to fill it up, not necessarily to loosen it, but to get rid of some of that junkiness so I can maintain more of a posterior pelvic tilt to kind of get me out of being stuck in here to get down here. So this is super, super good. Highly recommend you to do it just like this. And this is how the pole squat will look as well. So practice that breathing into this area. And because your stomach's going to be blocked by your thighs, it kind of stops you from breathing so much into your belly and forces you to breathe through your back. So love, love, love doing that. There's also the 3-month position that you can do. I don't know if this is it. Oh yeah, this is it. 3-month position where you breathe. I have a lot of clients, and when I taught classes, I would actually have them warm up for all their lifts doing this. You can have your feet resting on a bench, so you can be laying down here and your feet are resting on a bench, and you're just filling up into your belly, so belly breathing. But I do want to mention it's not enough to just focus on belly breathing, because if you only focus on belly breathing, you're only going to be breathing into this area. What happens when I only breathe into my belly? My low back arches because this is coming out. So you really want to focus on that 360 aspect, which is why doing the first breathing position that I showed you really helps block that belly. So when you are practicing breathing, you're not only doing it at your belly, but you're doing it 360. But I will say there are a lot of good benefits of belly breathing, clearing up digestion. You have your lymph nodes, your largest lymph nodes that collect, toxins in your body that kind of save your body are located right around your belly. So when you can breathe and loosen up that area, not only improving your digestion, but also improving your immunity as well. So super good things coming from belly breathing. But would have you practice these things. And lastly, I'm going to leave you with here just a little table of cues that you can start to use. Rather than like your chest position of being lift your chest up, have your chest down, your ribs pulled down. And lumbar position, hyperextended, we want it more in neutral. Pelvis position, anterior tilted, we want it neutral. Intra-abdominal pressure, we used to think needed minimal, now we need maximal. And previously known, people would say, squat, drive through your heels, drive through your heels. Well, now we know, yep, it's full foot position. So just leaving you with that there. And if you have any questions or anything, reach out to me, ask questions. But if you feel any limitations in your squat, take note of it. Highly recommend taking videos of your squat in a front position and a side position. See how you shift your weight, see what position works for you, and if you're able to maintain good core stability, practice breathing prior to, practice breathing afterwards.